First of all, there's a lot of myths about infertility in general. The big one is that it's just a woman's problem. So the first thing people should know is that infertility can affect men, it can affect women, and it can affect both the male and the female. I think the other thing people should think about and remember and know about infertility is that there's a lot of different ways that you can treat someone's infertility. For example, a woman could take medication and that could solve her infertility problems. It will stimulate her ovaries and she'll be able to conceive naturally. However, if that doesn't work, it sort of progresses from there to more involved and more invasive and also more expensive treatments. IVF, which a lot of people know of, in vitro fertilization, is the most involved infertility treatment, but also the fewest number of people use that. Less than 5% of people with infertility actually need or use IVF. So again, there's a lot of other ways that people can treat their infertility and are now able to become parents that don't involve IVF.
Really? So 5% of the people who are going through fertility could use IVF. Is
Less
that
than
right?
5% of people who have infertility
Okay.
need IVF to become parents.
Got it.
So they can either try surgery on the male or the female, they can do medication, they can do less invasive treatments and not go all the way to IVF. IVF is really reserved for those that have the more complicated issues, might be severe male factor, there might be issues with the female where it's just not working at all. Age is a big reason for using IVF. It involves, it bypasses a lot of the problems that might be going on with the woman in terms of producing eggs and that sort of thing. Plus IVF, it's a very controlled environment. And so you have a lot more control of the sperm and the eggs and the embryos and the timing of it. So if any of those things are a problem, IVF is generally the best way to go to solve those and to become a parent.
Would it be fair to say that IVF is kind of the last stop on the fertility treatment road?
It is. Really is. IVF is really the last stop for people in infertility treatments. If IVF using the sperm and the egg from the intended parents don't work, you can use a donor egg or donor sperm. You would still be doing IVF. Even a gestational carrier or a surrogate, that's still using IVF. So IVF is really the medical procedure that, not necessarily the last resort, but is the best option for the more complicated cases and where surgery or medication don't work at all.
Now, is there, are we seeing, have you seen where doctors are more likely to just go, okay, you're having fertility, let's go here without trying anything in between? Is that been a concern?
You know, when you are diagnosed with infertility, it could be a linear progression of different types of treatment depending on what the diagnosis is. And that's really important to get a really good diagnosis from a specialist. But you may bypass some of the lower tech, less invasive procedures given your diagnosis and go right to IVF. In fact, recent studies have shown that by moving more quickly to IVF, patients might actually spend less money and have a baby quicker and sooner than they would trying some of the less invasive, less expensive, and maybe not less effective procedures. So that's a study that's come out recently. It hasn't quite been put into practice yet, but we may see over time physicians advising patients, given their diagnosis, to move to IVF quicker. It again provides for a more controlled environment, and given certain diagnoses, it's going to be your best chance.
Want to brush here? Right there. Okay, well, this dovetails well into the next question. And are treatments covered by insurance? And if they are, does it vary from state to state?
You should make sure that you are very, very clear about your medical history, both the male and the female. Any STDs, any diseases, any hormonal issues that you might have been diagnosed. For the female, everything about her menstrual cycle. These are almost like vital signs for the physician. They are hugely beneficial in helping to diagnose the problems. But the questions that the patients should ask the physician are things like, given our age, What might you expect in terms of outcomes? Ask them specifically, if we do have to go to IVF, tell me a little bit about your program. What types of diagnoses do you see here? Do you treat? What are your success rates? Have them tell you some of those. What's their philosophy on single births versus twins or multiples? Ask them those kinds of questions. It's really important to get a feel. You need to really get to know your physician and the staff. Find out how easily and accessible they are, how accessible nurses might be. And then make sure that somebody in that office sits down with you and shares with you all the costs associated with your treatment. Maybe you don't know yet what your treatment's going to be, but when you do, make sure there's someone in that office that sits down with you. They should be fully disclosing all of the costs and then helping you determine if your insurance will cover it or not.
So this isn't one of the questions, but would it make sense if you have a good fit but the prices aren't the same? Can you price shop? Is that able? Is that something that you can do?
One of the things with the cost of treatment is that there's a lot of variables that go into that. And I would certainly talk to the clinic and ask them about any financing programs they might have. Some might be affiliated with companies outside of the clinic that provide loans. There might be ways that they can work with you to help finance it. It's typically not something that patients, though, can move around from clinic to clinic in comparison and shop. There's a lot of factors that go into that. But certainly it's worth asking and looking into all of those costs. Sometimes you might get a cost for an IVF and there's a lot of other procedures involved in that, and you might ask for a breakdown. For example, there's certain procedures that they do if it's severe male factor, and that adds cost to the treatment. You might want to find out, is that something we need? What about screening the embryos before they're transferred? Is that something your clinic is going to do? And if so, is that an extra charge? So all of those things can be extra, or they might be bundled together. Important to ask all of those questions.
Wow, I had no idea about those. So that's impressive.
They can do a lot of screening now on embryos prior to transferring them into the woman, and it's important to find out if that clinic is doing any of that screening, why they're doing it, if you might be a candidate for that, and what those costs may be.
Yeah, that's and the viability of the embryos is
certainly the pregnancy rates. If you're going to do any kind of screening or other kinds of procedures along with the IVF, is then asking what are the pregnancy outcomes if I do something like that. Absolutely.
Yeah. So now on the other side of this, as we've been doctors, always have, we realize not all doctors are created equal, and some of them sound good, and it turns out no, they're not. What are some red flags that patients can look for when they're going to a clinic, when they're going to a consult? What are some things that may make you think, I may want to go somewhere else?
In the field of reproductive medicine, there is a society, and it's called the Society for Assisted Reproductive Technology, or SART. And you can ask and go on the SART website and find out if your clinic is a member. About 95% of all the IVF cycles performed in the United States are done at a SART clinic. So that's a good sign, but it's important to ask, why is that important? Because this society comes out with guidelines and information that their members adhere to. And these are really the best medical practices in this field. So first and foremost, I would check and make sure that your clinic is a member of SART, SART.org. You can check there. In terms of red flags, if this clinic is telling you that they're automatically going to get you pregnant, that you're going to get pregnant on the first time, that their success rates are over 60%, those are red flags. Those are things that I would probably take a step back and say, helpful. You may have a really stressful time with your job, getting out of work to go to all these appointments, not being open with your employer. Then you have financial stresses. Wow, your insurance doesn't cover this, and now you're having to pay out of pocket. That's going to put a lot of stress on your relationships and your finances. A lot of people question their spirituality during an infertility journey, and whether that brings them closer or whether that brings them questioning, wow, I thought God had a plan for my life, and it was being a mom or being a dad. So an infertility diagnosis, if you will, touches so many facets of your life, and really all of them. And that's why it's so important to treat it seriously and think about all those things, but also get support and get a community around you, a network that's going to be supporting you.